Thank you so very much. It brings me great pleasure to welcome you all today to this wonderful event. As you might be aware, we are celebrating Universal Healthcare Day, which took place yesterday around the world, and it's a global initiative. And we're really happy to be able to use this event as an opportunity to create discussion points around people living with rare diseases, but also to participate in greater health strengthening system initiatives, which we know are so critically important. As a bit of an icebreaker and an opener today, and because we're all about engagement, we'd like to run 2 polls through this opening session, just to determine a little bit more about our audience, understand where you're from and who you represent. So Rani, if you can put up poll 1, please. And while we're doing that, I'm just going to give you guys a little bit of information with regards to today's discussion and with regards to UHC 2030 and essentially what we are celebrating. So for those of you who don't know, Rare Diseases International participated and have joined hands with UHC 2030 through the civil society engagement mechanism. And the entire initiative is really about developing a collaborative process involving multiple stakeholders and UHC 2030 partners at global and national levels in order for us to develop a strong collaborative way forward to ensure that no patient is left behind by the time we get to the 2030 goal. And in doing so, we are really just, wanting to engage, and that's what today is about. So please use the chat function. If you would like to ask questions, we encourage you to do so via the Q&A section. If you would like to pass comments, etc., please use the chat functionality. Let's use this as an opportunity to learn and engage and really walk away with a better understanding of what the joint objectives are. For those who also haven't seen, there's some amazing toolkits that have been placed under the resource section of the UHC2030.org website, and particularly one, our RDI one is up there as well, which is really encouraging, as it gives us such a great opportunity to be able to really use the toolkit that has been developed for people living with rare diseases to be able to participate in this lovely initiative. I'm going to ask Lani to put up the second poll. So we've determined that 74% of the individuals on this call are from Europe. We've got 5% from Africa, and the results disappeared shortly before I could do that. Sorry, Lani, that was my fault. I shouldn't have prompted you to move to the next one. Oh, there they are again. We've got 5% from Southeast Asia, a nice 11% coming through from North America, and 5% from South America. And the only sort of region not currently represented is that from the Western Pacific. Hoping somebody, we do get some participation from there as the call carries on. Shawani, if you wouldn't mind, please putting up the second poll, which is going to ask you a little bit more about who you are and who you're representing. So which stakeholder grouping are you representing? If you wouldn't mind just popping that through, and we can get some feedback on that. I'm going to just give it a minute or two for people to participate in that, and then I will introduce our first speaker. We'll give it another maybe 10 or 15 seconds. Okay, perfect, thanks. So we see that we have 50% of the call being patient advocates like myself. So really excited to see that, because I think we have such a tremendous part to play and such a big role in this conversation. And then we have 28% persons living with a rare disease. We have 6% civil society groupings, 11% coming through from the private sector, and 6% representative as others. So I think that that's a really good mix. We're really encouraged to see it. And we're looking forward to some great discussion today. I'm now going to introduce our very first, it's going to be a video that comes forward. And it is from, sorry, Shulani, the agenda disappeared as I was saying that. If you wouldn't mind just putting it back on for me. Thank you. Thanks so much. So I'm now, just forgive my pronunciation, but we have run through this and I'm hoping I get it good. So we are going to be hearing from Vytenis Andriukaitis. So Flaminia, I hope I did that justice, who is from the World Health Organization Special Envoy for Universal Healthcare. So Flani, over to you to play the video, please.
There are 300 million persons living with a rare disease in the world. They live with diseases that are chronic, progressive, disabling, frequently life-threatening, and most of which start in childhood. Persons living with a rare disease and their families are faced with stigma, discrimination, and lack of awareness and recognition in society. A major barrier is the lack of knowledge and expertise on the field and lack of awareness regarding the issue. As a vulnerable population, they are impacted in all aspects of their lives, including health, of course, but also education, employment, leisure, and economic status. As WHO Special Envoy on Universal Health Coverage, it is important for me to highlight that universal health coverage is about equity and that we must look at it on the platform of Sustainable Development Goals. Addressing the socio-economic challenges of persons living with a rare disease is key to advance Agenda 2030, achieve the Sustainable Development Goals, and leave no one behind, especially SDGs on poverty, health, education, gender equality, decent work, innovation, and very importantly, on reducing inequalities. Universal health coverage will not be truly universal unless the needs of persons living with rare disease are addressed. Finally, a key message to share is that the COVID-19 pandemic has unveiled pre-existing vulnerabilities and has disproportionately impacted persons living with a rare disease. Addressing the specific needs of this community is an essential part of COVID-19 recovery and the objective to build back better.
Thank you very, very much. Wow, some really, really thought-provoking words coming out of the WHO. But I think what stands out for me is that statement around we cannot consider ourselves to be inclusive unless we have fully engaged and considered the needs of people living with rare diseases. And I think as patient advocacy groups, as civil society, and as patients, I think it is something that we can all relate to, and ultimately the goal that we are all here for today. So without further ado, I'm going to hand over to Gabriela Cuevas, who is the co-chair of the United Healthcare Engagement, Civil Society Engagement Mechanism, and who will be providing us, she's also a previous parliamentary member, and she'll be providing with some context. So Gabriela, over to you.
Thank you very much, and thank you for this wonderful invitation. I believe that we have a unique opportunity to decide what do we want for the planet and for humanity. Perhaps we haven't learned the lesson from the pandemic, but if we do not achieve universal health coverage soon, by 2030, 5 billion people are going to be left behind. So we can write a different chapter in humanity's history, but it depends on us. I am now the co-chair of UHC 2030, and we have been promoting universal health coverage literally all over the world. And yesterday, we commemorated precisely the International Day for Universal Health Coverage. This is a moment where we need to understand on the importance on, again, writing a new chapter for everyone, everywhere, because we have just seen during almost 2 years with this pandemic, a lot of people have died because they just didn't have the option of going to a hospital or a basic clinic or take a test, or they are not receiving vaccines. So I really hope that we are learning the lesson, because we have a lot of things to do. This COVID-19 pandemic has underscored the considerable health, social, political, and economic risks and consequences of failing to invest adequately and efficiently in health. Sadly, it has widened health inequities both within and between countries. We need resilient and equitable health systems that leave no one's health behind in crisis and in calm. World leaders and the global health community have a crucial second chance to secure a safer and healthier future for everyone. We cannot afford to wait. It is simply not fair that some countries face acute COVID-19 waves and new variants unprotected. It is also a question of enlightened self-interest. No one is safe until everyone is safe. Otherwise, we are only going to be hearing news about new variants or perhaps about the new viruses or new diseases. But we need to understand that humanity is interconnected. We depend on each other, and the biggest challenges are not respecting any kind of borders or passports. I would like to tell you about my personal commitment and role within the UHC 2030 Steering Committee. UHC 2030 is a global movement that brings together diverse voices and perspectives in a shared endeavor to strengthen political commitment and promote collective action towards universal health coverage. It provides a multi-stakeholder platform to share experience and knowledge and develop guidance and advocacy tools to support more effective and coherent action based on a shared vision to strengthen health systems for both universal health coverage and health security. At UHC 2030, we believe that universal health coverage is not just a rallying cry, but rather an achievable and measurable goal. Strengthening health system, which are the organizations, people, and actions who promote, restore, or maintain health, is the most efficient and sustainable way to reach UHC and to promote health security. I have a great co-chair, Dr. Justin Koenig, and we are keen to ensure that UHC 2030 helps partners around the world to make a difference on the ground and that commitments translate into action. And that's important to say because we are working with politicians, with civil society, with academia, with international organizations. I used to be a member of parliament until 3 months ago. I was a senator, a parliamentarian, a local authority, and I have been also at the international, at the global sphere. And I believe that we need to translate those international commitments into local and national realities. In 2019, the world leaders endorsed the most ambitious political declaration when it comes to health. They decided to commit to universal health coverage. But from that commitment to the national and local realities, there are a lot of things we have to do. And when I was a member of parliament and also president of the Interparliamentary Union, I took a particular interest in the role that parliamentarians play in making UHC a reality through legislation, budget allocation, oversight, representation, and ratification of international agreements. I am also keen on promoting concrete measures countries can take to address barriers to accessing health services and to ensure a truly intersectional, gender-responsive health systems approach, which is inclusive not only of gender, but also of age, race, sexual identity, socioeconomic status, and geography. At the UHC 2030 Steering Committee's current priorities and actions to foster strong, equitable health systems, well, there's also a lot to say. For our shared vision of health systems that leave no one behind, we must make sure people and communities are at the center. We need to place people. We need to understand that persons are at the center of all decisions, all policies, all actions. And this means aligning systems-wide investments in health and complementing movements to increase access to comprehensive and quality health services with those looking to improve immunization, water and sanitation, education, and the many other determinants of health. The disruptions to healthcare we have seen in many settings during the COVID-19 crisis remind us that all health agendas must be integrated with broader effects to build strong health systems based on equity and on holistic, again, people-centered approach. To improve collaboration among various health initiatives, UHC 2030 recently established the Coalition of Partnerships for UHC and Global Health. Recognizing that UHC is key to addressing barriers to health services and improving the quality of care across all areas of health, the coalition unites health leaders and advocates in a common goal to align advocacy and accountability efforts to achieve UHC and advance the Sustainable Development Goals. The name says a lot, UHC 2030. We need to understand that for SDGs, for SDG 3, and of course, in terms of UHC, we have very few years. And we just had 2 very complicated years. So every day counts here. We need a strategy, but most important, we need an implementation route to make UHC a reality for everyone, everywhere. Earlier this year, UHC 2030 also worked with WHO to launch the Handbook on Social Participation for UHC to support policymakers with institutionalizing participatory governance. We cannot understand the governments or politics without civil society. For example, as a former parliamentarian for a lot of years, well, we are elected. Well, we were, because I am not anymore. I need to get used to that change. But we were elected as people's representatives. We cannot understand politics as a divorce from civil society. That's the most natural partnership for a politician, and especially for a popular representative as a parliamentarian. Also, I would like to recommend to you that the Civil Society Engagement Mechanism, CSEM, launched the Health for All Advocacy Toolkit as a resource for civil society to engage policymakers and kickstart their advocacy for UHC. We are working with different stakeholders. And the other very important product I think that we just launched is the Parliamentarian Guide. It is called 6 Action Steps to Achieve Universal Health Coverage, which provides a tool to help parliamentarians ensure that the right to health is reflected in national legislations and that countries set aside sufficient resources to implement UHC reforms. For example, at the Interparliamentary Union in September 2019, we adopted a very important resolution on UHC, but that was at the global level. Once parliamentarians are going back to their countries, there are a lot of things to do. Even with the best political will, translating that resolution into a national reality, into, for example, a bill to change or to amend the Constitution, or a more comprehensive bill to change the national legislation for recognizing the human right, but also the process for implementing UHC, needs a lot of resources, a lot of talent, and a lot of political participation, because if you want to change the law, you need a majority. But once you have that change in terms of legislation, then you need to allocate resources, and budget becomes one of the most important processes. Here, I would like to share with you, I started before politics a lot of time ago, 27 years ago. I first started as a civil society, as an NGO, we used to call it that way at that time. And one of the things that I have discovered in the latest years as a politician is that it is very easy to say that something is a priority for politicians. But the only way where we are going to really say and discover if that's a priority is taking a look to the allocation of budget. If a priority is not reflected in budget, that's not a priority. In my country, we used to say that true love is reflected in budget. So once you are working with politicians, governments, parliamentarians, please take a look not only to the legislation, but also to budgets. Here are just a few of the many resources that UHC 2030 has worked on to help different stakeholders to support the UHC agenda. And following the results of this year's States of UHC Commitment launched yesterday during UHC Day, we called on global leaders to convert their commitments into action and accelerate the implementation of their commitments to achieve universal health coverage by 2030, to develop and communicate clear pathways to achieve universal health coverage in their countries, to align health systems investments using a primary healthcare approach, to create space for meaningful social participation and value the involvement of non-state actors, to identify and reach all groups in society at risk of being neglected, to ensure gender equitable leadership and gender responsive health systems, and of course to collaborate beyond the health sector on both universal health coverage and wider determinants of health. We have a lot of examples and best practices of policy interventions for addressing barriers to affordable health and social healthcare for vulnerable populations. COVID-19 has reminded us that primary healthcare is our first line of defense and response. Strong primary healthcare also reduces the burden on secondary and tertiary care through more effective and early interventions, and allows more people to access the care they need. To keep people safe and healthy, we must strengthen health service delivery, essential public health functions, and emergency risk management. And most importantly, we need to empower communities to decide about their health. We must also create stronger social and financial safety nets beyond health services to protect the livelihoods and welfare of vulnerable groups, including women, children, and adolescents, the poor, the elderly, people with disabilities, migrant populations, the homeless, and people living in remote communities. We need to understand that vulnerability doesn't define people. Vulnerability is a condition. It's circumstances that the state and all of us need to decide also to change. We need to look for more inclusive societies in every possible aspect. Governments, health leaders, and advocates work together to promote good health and well-being for all, focusing on a holistic, people-centered approach that prioritizes the most vulnerable and that aligns with the principles of human rights, gender responsiveness, and respecting the voices of people affected by or at risk of disease. Governments must also clearly communicate on progress and the actions that they are taking to achieve UHC, including setting clear targets to improve service coverage and financial protection and communicating them clearly to multi-stakeholder audiences at local, national, and even at global levels. Furthermore, national targets should be publicized openly and made understandable and accessible for populations across the world. This is essential in order for people, particularly the most vulnerable, to be able to hold their governments to account in meeting their UHC commitments. Well-trained, well-paid health workers are another important component of strong health systems, the majority of which are women, and we must underline that part. Governments can and should support, protect, and care for health workers, including community health workers who are critical to reach vulnerable communities. There are some data that I believe it's important to share. About 70% of the health workers are women. Women were and still are at the front line of this pandemic. Women in the health sector are saving lives every single day. But when it comes to taking decisions, women are not being taken into account. For example, at the last World Health Assembly, only 1/4 of the delegations were women. So we need to change also that reality. If women are not well represented, who is going to take care of the different needs that we might see? For example, Women in Global Health is having a very interesting campaign talking about the different needs in terms of equipment. Body for men it's not the same body for women. So why all the uniforms, all the equipment is done in the same way and surely designed for men? So we need to change that. We need to change a lot of inequalities, even within the health system. I believe that one of the important things here to underline is that as a global community, it is our imperative to hold decision makers accountable for their commitment to achieve universal health coverage by 2030. But to drive change, we need a movement of the people, of civil society, to make sure the foot of government is on the accelerator and not the brake. This is why establishing and institutionalizing participatory governance mechanisms is an essential investment in creating equitable and resilient health systems. Civil society and community participation ensure policies and programs are responsive to end users, including those with health needs that are often under-prioritized and other vulnerable communities, and reach their full impact in practice. Only accountable and participatory health governance mechanisms can truly ensure that no one is left behind in the progress toward UHC. That's why civil society participation should be institutionalized as an acknowledged format relating for monitoring, reviewing and making recommendations, and for monitoring the solutions and actions that follow. The process should also be democratized so that all levels of political leadership, government, and other stakeholders listen to and act upon the expressed needs and priorities of the people. As a conclusion, it is important to remember that achieving universal health coverage makes positive inroads in all areas of health and development. As we look ahead in the midpoint of the Sustainable Development Goals in 2023 and the next UN high-level meeting on UHC, there is a critical role for all stakeholders at the global, regional, and national levels to frame messages around universal health coverage as a unifying agenda to achieve a healthier and safer world. The time is now to accelerate progress and promote health for all. And again, I believe that the best way we can truly commemorate UHC Day is understanding that this is about taking a decision. We can choose between being the generation that insists in inequalities and exclusion, leaving billions of people away from health systems, or we can be the generation that is driven by inclusion, that understands that health is a human right, and that is not only words, that must be turned into actions. Thank you very much for this invitation. It has been my pleasure to be with you.
Wow. Thank you so very much, Gabriela. I think some absolutely pertinent points coming through. There are a couple of questions, and I know that you are at the airport at the moment, so I thought I'd take the opportunity to maybe let you run through them, if that's okay. The first question is, what is the best way for vulnerable members to be able to participate in the process? I know you highlighted the toolkits, with particular interest, the one with regards to parliamentary engagement, which I think is absolutely critical because that's ultimately where the decisions need to be made. Are there any other sort of reference points that members who are wanting to participate can refer to?
Yes, of course. I think that we also have two very important documents at the UHC 2030 website. And those are the documents that we call the State of Commitment. We published the one last year and we just released the second one yesterday. And it is a very good research and publication that speaks on the best practices at the national and local level. And it has also a cross-cutting approach because that goes also in a very useful way for civil society. I do believe in political leadership because at the end, we are voting for someone who is going to decide on the taxes that we are paying, someone who is going to be changing legislation that affects our daily life, or perhaps someone who is willing to make a constitutional amendment to guarantee health for all. So we need to give the importance to the political side, even if I know that civil society usually takes distance from the politicians. I was a politician and also a member of civil society organizations. So I know about that distance, but that distance is not creating better politicians and is not creating better democracies. And of course, that is not guaranteeing our human rights. So we need to change that part. Please be sure on how you vote, who are the people that you're deciding for. And I think that one of the most important parts are to take a look to budgets. Budgets are the most sincere perspective on what a government is doing. If UHC, if rare diseases are not reflected in budgets, your politicians needs you, and you need to raise your voices. And the other part, which is of course linked to the previous one, is accountability. In many governments and in many countries, accountability is not well seen. Sometimes politicians are very confused between accountability and opposition. And being accountable is part of why politicians are receiving a salary, because as the clients, well, we can have demands and we can ask for results. So that's an important part. But the other one that I would like to share here is my own experience in my own country. I am from Mexico. And in Mexico, civil society plays a very important role when it comes, for example, to vulnerable populations. The best organizations or the best heroes that we can find, for example, working with immigrants and refugees, is civil society, our people's organizations. So that's also a very important point. It is not only on depending on governments or demanding our rights as citizens. We can also take our hands on and make some changes. So I believe that if you're here, it's because you're doing that. You're already helping and working and demanding. But again, even that, I know that politicians are not the most popular thing right now. The only way that we can strengthen our democracies and make important and deep changes and make UHC a reality is changing legislation, changing budget, changing policies, and of course, asking for results and making our politicians accountable.
Thank you so very, very much. Thank you so much for your time. We really, really appreciate it. And it's been absolutely insightful and completely engaging. So we really do appreciate it. I would like to remind everyone, if you're wanting to send comments through or ask any questions, you can do so either via the Q&A or via the chat. I also see that someone has kindly posted quite a few publications, etc., on the chat. It might be worth looking at. Very, very fruitful information coming through there. We're just going to switch the order of events around a little bit. And we're going to go through now to Ritu Jain, who's from DEBRA International and who's also a member of the RDI Council. And Ritu will be going through the RDI Health Equity Statement. So Ritu, over to you.
Thank you so much, Kelly. It gives me great honor to be presenting the statement for Universal Health Coverage Day on behalf of Rare Diseases International. As a global alliance of people and families living with rare disorders, we at Rare Diseases International are committed to promoting the delivery of high quality health and social care for everyone around the world, across all countries and across all rare disorders. We truly believe that this goal of equity can be achieved through social justice and its hallmark, equity. And it's important for us all to be on the same page for our understanding of the term equity, which can be a little tricky and commonly misunderstood and equated with equality. So we understand equity as the actionable social justice because it focuses on reducing inequalities that Gabriela also just highlighted, the inequalities that are social, technological, and economic, while also promoting equal opportunity for greatest level of health and well-being in order to leave no one behind. So allow me to give you some context and expand on the terms that are central to our statement of equity and inequality, of equity and equality. So the 300 million people that Gabriela just referred to, the people and families with rare disorders around the world, regularly face inequalities that have been worsened by the COVID-19 pandemic. So if we are to truly build back better and leave no one behind, we need to pay greater attention to the principle of equity. So on the one hand, equality is the principle that fairness is achieved through giving the same quantity or the same resources and opportunities equally to everyone. It implies that everyone must get the same in order to achieve an equal situation. In contrast, equity that we promote is the belief that fairness requires a recognition that different circumstances, the different challenges that every person faces. It implies that everyone gets according to what everyone needs for them to reach the same finish line. It understands the staggered needs and requirements of each individual to achieve the parity that we strive for. So we must say that equity is a way to restore equality of outcomes, not just of provision of chances and opportunities. So we believe that in a world where everyone faces different circumstances, giving everyone the same, as we can see in the images that Shaulani is sharing, has no effect on progressing towards social justice, and in fact, might even increase the inequalities. So how do these terms apply to rare disease communities? The communities that we work for, as well as their families, deserve social justice and equity, meaning that all people with rare disorders, regardless of where they live, have the same opportunity for accurate and timely diagnostics, access to health, as well as social care. And this can only be done through doing more for those who have less. That is, reaching the furthest behind first. Vulnerable people living with a rare disease experience several layers of vulnerability, those that are physical, social, economic, and technological. And these must all be addressed holistically and through a specific policy and action. But there is hope that we all rejoice and celebrate. Light at the end of the dark night, thanks to the UN resolution for people living with rare disorders. The first ever UN resolution on people living with rare disorders, called for by RDI, as well as its partners, recognizes that communities may require targeted action and support for accessing benefits and services in education, employment, health, as well as to promote their meaningful participation in society. This resolution also recognizes the fundamental importance of equity, social justice, social protection mechanisms to ensure universal and equitable access to quality health and social services without financial hardship for people living with rare disorders as well as their families. The resolution is a demonstration that equity can only be reached through an understanding and recognition of the needs and circumstances of vulnerable populations. It requires an understanding of the different national contexts, different social and cultural circumstances, the staggered healthcare systems, and specific barriers in accessing diagnosis, health, and social care. So then what is the role of RDI in facilitating these ambitious but critical goals of health equity? RDI, through its member organizations in over 100 countries, as well as through a global network of rare disease stakeholders, facilitates the understanding of the challenges encountered in contexts that can be extremely diverse, national and regional circumstances that impact these challenges. And RDI highlights these and can support the development of initiatives that are responsive and tailored to different contexts. RDI can also promote a common understanding of what equity means from the perspective of the communities of the people with rare disorders, as well as their families within the international community. Understanding that existing frameworks don't adequately meet the specific needs of this vulnerable population, RDI advocates for rare diseases as a policy priority, necessitating concerted and tailored responses. So in conclusion, I'd like to reiterate that if governments really aim to achieve universal health coverage and really leave no one behind by 2030 in a bid towards a more inclusive society, the collective focus needs to be on equity. Actions to achieve greater equity should be responsive to diverse realities and disadvantages, including the inequities experienced by vulnerable populations, such as those with rare disorders. Thank you. So now, to initiate a discussion around the topic of how best to achieve equity and universal health coverage, we have two questions for you. May I request you, Shaulani, to please float the first poll? Are there any universal health coverage related activities in your country? We'll give you a few more seconds to respond to that. Okay. Are we ready for the results, Shaulani? Well, I'm glad to see there's a 41% response, the greatest, well, not the robust response that we would aspire towards, but very optimistically, 41% responses on equity-related activities in your sector. And the second poll, Shaulani, please. What is most needed and should be a priority, in your opinion, to promote universal health coverage and achieve greater health equity? This is a multiple choice question, and we'd like to request your response. Another few seconds for you to read and respond and select the options. Thank you, Shaulani. So we have a very clear mandate that 82% believe that the greatest priority is rare disease policy and a national strategy for people living with rare disorders. Thank you for that. Also, clearly there's a distribution with access to diagnosis as being a very good high priority, followed very closely by clear patient care pathways, as well as centers of expertise and access to services, access to medicines, and reduced out-of-pocket expenses. Thank you so much, Shaulani. This is very indicative of the priorities of rare disease populations globally. And let's see how much they apply or how the implications of these. Just to conclude this session, we have a brief conversation with Diego, the president of the Colombian Alliance for Rare Disorders, a colleague at Rare Disease International and an advocate from the Global South. So Diego, if we may have a few moments with you.
Yes.
Hello.
Thank you, Ritu. Hello, Ritu.
You.
Thank you for the invitation. Thank you to Rare Diseases International for this special invitation.
Welcome, Diego, and really looking forward to some insights from the Global South. With the first question, if I may, is equity and health, and particularly health equity, a consideration for policymakers in Colombia?
Yes, in Colombia since 2015, our government issued the law 1751. The objective of this law is to guarantee the fundamental right to health, regulated and establish its protection mechanism. This law says that our government must formulate and adopt health policies aimed to guarantee the right to equal treatment and opportunities for the entire population. With this law, our government must adopt public policies to improve the health of low-income people, vulnerable groups, including rare diseases patients and people of special protection. Our government recognizes and must guarantee the fundamental right to health coverage to every community, considering their specific needs. For example, indigenous people and communities like Gypsy, Black people, Afro-Colombian, and in other specific communities, the right to health will be guaranteed by our government.
Thank you, Diego. That's really optimistic. That's really wonderful to hear that you do have a plan and policy in place. But does Colombia have a universal health coverage plan?
Yes, in Colombia, according to our legislation, the right to health includes access to health services in a timely, effective, and quality manner for the preservation, improvement, and promotion of health. Our government must work on policies to ensure equal treatment and opportunities in access to promotion, prevention, diagnosis, treatments, rehabilitation, and palliation activities for all the people. Our legislation considers a principle of universality in health coverage. According to our legislation, the people that is residing in Colombia will enjoy effectively of the fundamental right to health in all stages of life. Our health system must guarantee the fundamental right to health through the provision of services and technologies structured on a universal conception of health.
That's amazing. But may I then just follow up with a question, to borrow from Gabriela's address previously. As she said, these strategies, these plans are only real and true love is seen in the budget. So are these policies also followed by a budgetary allocation, or are they currently plans?
For universal health coverage?
That's right, as well as access for people living with rare diseases. Do you have equitable access to health for these people, or are these still just principles, not actions?
Yes. It's important to say that we have so many or several opportunities in the implementation. We have a very important legislation. In Colombia, we have a rare disease law since 2010. This law says that our government will recognize rare diseases as a national interest issue to guarantee access to health services and treatment and rehabilitation for people who are diagnosed with rare diseases. This law also says that our government must design strategies to promote the inclusion and social integration of the population of patients with rare diseases, such as access to goods and services and education and employment. This law includes our population as a vulnerable population, and this law says that our healthcare will not be limited by any type of administrative or financial restrictions. The institutions, the different stakeholders that are part of the system must define intersectoral and interdisciplinary care processes that guarantee the best conditions of care. I think that this law is a big step for our rare disease community in Colombia and makes us very happy. However, we are still working on the full implementation of those laws, because we think that our health system is designed for patients with the most prevalent diseases, and there is no differential approach to the needs of patients with rare diseases. There are not strategies to address specific needs of our rare diseases population. We have the law, but we have to work on those strategies, and that is one of the reasons why we work with our federation, with FECOER, because we want to change this reality. We have made the progress in health coverage of the poorest people with a special government program. However, there are still challenges to provide high quality healthcare for them. We have patients with for example, who live far away from the big cities and do not have access to specialized care centers or expert health professionals. Some reasons for this lack of equity is the lack of resources, in some cases, hospital infrastructure, lack of training of health professionals, lack of coordination between the local and national institutions, and in some cases, corruption from people from our government. I think that our job as a social organization in FECOER is to work for that equitable access for all the patients, caregivers, and families. Many of the actions for our population in different regions of our countries are framed in disability policies. It's important to say that. However, it's important that the problems of the diseases, of the rare diseases, can be addressed exclusively, cannot be addressed exclusively from disability. I think that there must be a differential approach that considers, of course, the universal health coverage, but it's important to consider the specific characteristics, the specific needs of the rare diseases population. Finally, I want to say that achieving universal health coverage goals is a long-term path, but I think that the progressive progress can be made by each country. I think that the most important thing is to know the specific needs of the rare diseases community and develop focused strategies with the support of the different stakeholders.
Thank you, Diego. Certainly a lot to learn from you, as well as to work with you to help you achieve those principles enshrined in Colombia's universal health coverage policy. Thank you so much for bringing us insights from the Global South, from Colombia. And I will hand over back to Kelly with that for her to continue. Thank you.
Thank you so, yeah, thank you so very, very much, both Ritu and Diego. Interesting stuff. And the poll results on 82% of the participants believing that a rare disease policy is the first thing that's required in their country is really quite something. And it goes back to Gabriela's point around the budgetary. If the budget's not there, the work's not going to be done, and it's quite simply that simple. All right, we're going to go back to try and get Carthi Mannikarottu's video up. Once again, Carthi is the communications officer for the civil society engagement mechanism, Secretariat, as well as from WACI Health. So Hlulani, if we can try get that video up, thank you.
Hello. My name is Carthi Mannikarottu, and I'm the Communications and Advocacy Officer at the Civil Society Engagement Mechanism for UHC 2030. Thank you so much for having me here today to present one of our newest resources, the Health for All Advocacy Toolkit. Just a bit about CSEM. We are the civil society constituency of UHC 2030, and you must have heard from Gabriela the great work that UHC 2030 does to bring all kinds of stakeholders together to build strong health systems for UHC. The CSEM exists because we believe that civil society is essential to create UHC policies that are inclusive and equitable. And that we have to continue our focus on civil society and communities to have truly universal healthcare for all. We see UHC as this unifying agenda, which I'm sure many of you who are here today do as well, because UHC is critical. Universal health coverage is enshrined in SDG 3, and it also relates to many of the other SDGs the world has committed to. As we've seen more than ever during this COVID-19 pandemic, perhaps, health is fundamental, health is cross-cutting, and there's really no way to address a health issue without looking at it from a cross-sectoral perspective. And as a foundation, we should be looking at strengthening health systems for all diseases and for all people. So this is kind of the background on why we built this toolkit, because we believe that UHC is truly cross-cutting. And in the lead up to the United Nations high-level meeting on UHC in 2019, the CSEM and partners did a bunch of consultations around the world with stakeholders who were interested in UHC and wanted to learn more about it. And what we heard a lot of was that we had civil society and community representatives asking for more resources. UHC is often seen as a technical technical concept, and there was a need to have more available for people who might be new to the health policy field, but also new to just the UHC component. We also did a survey earlier last year asking for what kinds of information would be most useful to have in this toolkit. So currently we have this, I would say, introductory toolkit. It has 3 parts, and the first, it introduces some basic concepts on what UHC is and why it's important. The second is about the role that civil society plays for UHC. And the third has some practical guidance on how to participate. Now, this is a live tool, but it obviously does not include all of the many ways in which civil society and community advocates could engage on UHC. But it's really meant to be a starting point, a way to kickstart advocacy and see how you can integrate UHC messages into the work that you're already doing. It is currently online in English, French, and Spanish, as well as downloadable versions. And we hope to add more translations in the next few months. So just looking at the sections very quickly, I know we have limited time and I don't want to take up too much of it. It is online. But the first part is the what, the why, the key timeline, and then a few examples of like what we mean when we say UHC. And the reason that's so important, the reason that's so important is that for joint advocacy, we really need to have a shared understanding of UHC. And since it's considered a technical concept, that limits who can engage and how. But it doesn't have to be a complex term. Of course, the how to achieve UHC is of course complex, and what it looks like is complex. But at the core of it, universal health coverage is the aspiration that all people can obtain the health services they need of good quality without suffering financial hardship. That has 3 components. All people, meaning more equitable. They can obtain the health services they need, as in it's more accessible, without financial hardship, as in it's more affordable. In the second component of the toolkit, there is more examples of civil society advocacy, and particularly of successful civil society advocacy in each stage of the policymaking process. We also have a set of 4 key advocacy messages that was developed through a consultative process with civil society organizations and advocates in 2019 and continued through COVID. And the advocacy messages focus on equity, on increasing public financing, on supporting health workers, including community health workers and community-led health systems. And lastly, ensuring that civil society and communities are engaged, because we truly do believe that social participation is the only way to create health systems that are responsive to the people and truly serve the needs of the end users. And the last part includes templates that you can download on creating an advocacy plan, on budgets, on M&E, and on doing that landscape research of where UHC in your country currently is. There's also a resource library. It includes, for example, the UHC 2030 data portal, which was just updated last Sunday for UHC Day, and now contains recent information from the 44 countries that participated in the voluntary national review process. I also wanted to add that the CSEM released our own advocacy paper based on the results of 19 focus groups we did with civil society and community members this year all around the world, and include some insights and recommendations for policymakers. Please do find that on the website as well. We see that the toolkit to be a starting point, as I said, it's not meant to be all inclusive, but it is meant to be collaborative and live and be adapted to the needs of users. So the first category that you might want to use it in, it is as a learning tool. It will be updated. There's a feedback form, so please feel free to let us know what you would like to see and any adaptations you would like to make. We will also soon have discussion forums open on the website. The second suggestion is to use it as a conversation starter. We have been doing regional workshops. We had one in Asia and one in East Africa, and we'll continue to do these. But we also have all these materials, including a longer presentation that goes through the toolkit, as well as recordings of the workshops available so that anyone can take the workshop and do it. There's a facilitator's guide, there's a worksheet. So the idea is that you can use it to really build networks in your region, with other sectors. And lastly, it is an opportunity to join the CSEM itself and be a part of some of these joint global advocacy moments, whether it's the C20 or UHC Day. There are key moments throughout the year where all kinds of universal health coverage advocates come together for this shared messaging. And lastly, we hope you are able to share it as much as possible, especially with people who might be new to advocacy or new to UHC advocacy, and also share your best practices as you go through this toolkit. We'll soon be having a story series on the website that features some organizations and how they've been using this toolkit. That was my quick run through of this. Please do find it online at csemonline.net. Apologies for not being there for the live Q&A, but feel free to email with any questions.
Wow, thank you so very, very much. That was absolutely riveting and just really shows the extensive nature of that toolkit and how it's been designed, particularly with patients in mind. And what's really so important that it's been designed by the people for the people. And I think, really, really hats off to the team that has put that together. Very, very, very great work. And I encourage you all to go have a look at it if you haven't yet already. And obviously to use it and use it as inspiration for your local plans and action points. And lastly, we're going to be listening to Flaminia, who is going to be, Flaminia is the RDI Executive Director, and she's just going to be giving us an overview of strengthening healthcare systems, particularly for people living with rare diseases, with regards to the global community in action. So Flaminia, if I can, hand over to you.
Yes, so today we celebrate UHC Day. So let's start maybe by seeing and having a closer look at what UHC tells us. So UHC, the objective of UHC is to ensure that all people, wherever they are, can access the quality essential health services they need without being exposed to financial hardship. So UHC, as we heard already, includes 3 dimensions, and member states do need to consider these 3 dimensions of coverage when they progress towards universal health coverage. We heard it already. UHC is in terms of population, in terms of services, and in terms of the proportion of costs that are covered as opposed to out of pocket. So because rare diseases is firmly positioned into the universal health coverage political declaration, what does it mean for persons living with the rare disease? It means that more persons living with the rare disease need to have access to more services that are delivered with less out-of-pocket expenses for themselves and their families. Why universal health coverage is important? Well, first of all, universal health coverage will guide the reforming and the strengthening of health systems in this decade up to 2030 and most probably also afterwards. It represents a big opportunity for the rare disease community because not only does it encourage the adoption of specific policies and measures for rare diseases, but it also provides an opportunity to leverage the non-specific rare disease policies that have an impact for persons living with a rare disease. Also, universal health coverage and rare disease policies are or can be or should be mutually reinforcing because the health coverage is not universal if it does not include rare diseases. And also for governments to target national policies for rare diseases will contribute to the national efforts towards universal health coverage. So I was asked to talk about, I don't know how to remove, to talk about strengthening care systems to achieve equity. So universal health coverage requires specific measures that will strengthen healthcare systems to ensure health equity. That means reducing inequalities and facilitating equal opportunities to the greatest level of health for all persons, including the most vulnerable populations, such as persons living with the rare disease. And as it was already said, especially in this situation where COVID has exacerbated all of these inequalities that we want to reduce, building back better and inclusive societies for all persons certainly more than ever means leave no one living with a rare disease behind. So the key message from the global community of persons living with the rare disease would be that for health coverage to be truly universal, it needs to focus on equity. Measures towards achieving UHC should indeed be adapted to diverse realities and to multiple forms of inequalities that can be pretty different across countries. So the global community, who is the global community? Well, I would like to just present you Rare Diseases International in a nutshell. It's the global alliance of persons living with the rare disease across all countries and across all rare diseases. Our vision is a better life for our community, and RDI's mission is to be a strong voice for persons living with the rare disease and their families around the world, with the objective to advocate for rare diseases as an international policy priority, represent persons with rare diseases and their families at the international level, and support the empowerment of members to advocate at national level. As it was already said, we are active in more than 100 countries covering all continents. So just very briefly to say, sorry, I went too fast. Very briefly to say that in our story, in the milestones of our story, there is also September 2019, when rare diseases were included in the political declaration on universal health coverage, and where we joined UHC 2030. So talking specifically about universal health coverage, we started, the topic is about community in action. This is an example of a powerful rare disease community in action. So we started in 2018 to be present at Friends of UHC event at the UN. Then we organized meetings. We developed a position paper about leaving no one behind in universal health coverage. We hosted a side event at the World Health Assembly. And throughout 2019, we campaigned with our national alliances. The national level is so important to reach out to ministries. And this ended up in September 2019 with this milestone about the inclusion. We joined, as I was saying, the UHC 2030. And last year, for the first time, we celebrated UHC Day, launching a UHC for Rare Disease campaign. We developed this UHC for Rare Diseases toolkit. This year, we translated into 8 additional languages, fact sheet, letter template for members to be able to mobilize the national level, a briefing package and a social media kit. And then there is the event of today, UHC Day event on strengthening care systems to achieve equity. So international advocacy, there is here, our community is in action towards the implementation of universal health coverage at national level. As you know, there is this big milestone for the community of persons living with the rare disease around the world, the UN General Assembly resolution, and the work that we are doing in parallel and that we might even strengthen with the Human Rights Council. So very briefly, a UN resolution on persons living with the rare disease as a contribution towards Agenda 2030 and universal health coverage. The challenges of persons living with the rare disease must be addressed in order to meet several SDGs, certainly the one on no poverty, obviously on good health, access to quality education, gender equality, access to decent work, more innovation, and the reduction of inequalities. I know this is a very crowded slide, but just to say that within the UN resolution that is going to be adopted on Thursday, there is a specific call by the General Assembly to strengthen healthcare systems, to provide universal access to a wide range of healthcare services. There is also a call for member states to support the creation of networks of experts and multidisciplinary specialized expert hubs for rare diseases. And then the paragraph 11, which is about calling upon member states to accelerate efforts towards the achievement of universal health coverage, cover persons living with the rare disease, and stop the rise and reverse the trend of catastrophic out-of-pocket health expenditure. So as a community, we made rare diseases visible in the UN system. We are about to get the adoption of a UN General Assembly resolution on persons living with the rare disease. We're going to follow up on the UN resolution with other agencies, and we are going to work on the implementation of both the UN resolution and the UN political declaration on universal health coverage. A speaker earlier during this meeting talked about health as a human right. I think it was Gabriela Cuevas Baron. So indeed, we're going to work in the implementation of the UN resolution more with the Human Rights Council, appropriate care. This is very much the work we are already doing with the WHO and the establishment of this collaborative global network. I'm going to briefly touch upon it in a second, and then continue the advocacy at national level for measures, policies for the community with the backing of a UN resolution, and then inclusion in the UN system, more agencies and more programs, UNICEF, Children Education, UN Women for Gender Equality, UNDP, World Bank, you name it. So very briefly, we have a lot of global initiatives. We are a very active and dynamic community, but just to mention something here about health equity and access. We have a memorandum of understanding with the WHO, RDI and the WHO signed it in 2019. We support also equity by developing an operational description of rare diseases. So really to inform both the WHO and the member states about what are we talking about when we talk about rare diseases. It's the first step, knowing what are we talking about. Then there is the collaborative global network, which is to strengthen healthcare system and improve the organization of health and care services delivery. And last, it's the inclusion of more diagnostic and medicines within essential lists. We also have an access working group within RDI to identify barriers to access. So very briefly, the collaborative global network, I really refer also to the UHC 2030 International Health Partnership Advocacy Guide, because it's exactly in line with the collaborative global network, which is about promoting collaborative working and networking in countries, so at country level, at national level, and globally, to strengthen healthcare system as a way to ensure equitable and timely access to diagnostics and care for persons living with a rare disease. Thank you. I hope I didn't take too much time.
No, not at all. Wow. Thank you so much, Flaminia. I think for all of us who represent the patient community who have through times felt alone and isolated, I think it's very, very clear that the global network is in action and that there are points and organizations and opportunities for us to all work together and unite as a common voice towards common objectives. And it's really, really encouraging to see the multinational an international global collaborative approach. So well done on all the fantastic work, as always, that RDI is busy with and doing. I have seen there have been 1 or 2 questions that have come through, one of which I think strike, and it would be very, very interesting, and I'm not sure how we could possibly look at engaging on it at the moment, but maybe people could comment in the chat box with regards to funding, and going back to what Gabriela said, which I think must be a very pertinent point because it stayed fresh in mind for all of us with regards to the budget constraints and not having budgets available. There was a question with regards to whether or not budget should be ring-fenced essentially for rare diseases and kept separate from chronic other healthcare budgets and chronic disease budgets. It would be very interesting to see if there's any consensus around that. And I, for one, know that it is something that we've looked at within the South African context, but it would be very, very interesting to see what the feeling is across all those who are participating today. So if anyone is available, yeah, Flaminia said we should have a poll, and I'm not sure, Durhane, if it's possible to add a poll question at this late stage, but if it isn't, maybe we can just all put it in the chat. It would be very, very interesting to see which countries out there do actually have centralized ring funds specifically for rare diseases and have a dedicated budget, or how many of us are fighting for a piece of the chronic disease pie. It would be very, very interesting to know. And then also there was a question that had come through. Someone had raised their hand, and we have said that we would allow her the opportunity to speak. So Fulani, if you wouldn't mind, please allowing, I'm just going back to find it. I think it was Leah. If we can please allow Leah the opportunity to speak and provide her question.
Right, Leah's mic is open if she'd like to contribute.
You are on mute, Leah.
Hi, good morning. My name is Luisa Fernanda Alzate. I have a child with a rare disease. She has Enfermedades de Gaucher or Gaucher disease. And she has 3 genes with others disease, but don't have investigation in Colombia. We try to go to other center in other country, but they need recommendation for his doctor, but the doctor says she can give me a recommendation because the politics in Colombia don't permitir, I don't know the word.
Don't allow.
Give me that because Colombia, we have to pay for this organization. And for that, my daughter can receive this treatment or this investigation. And this is very sad because if we need a center investigation in Colombia, but we don't have investigation. And if don't have investigation, no information for my daughter, no healthy for her. You understand? I'm excuse me because I don't speak English very well.
No, it was very clear, very clear. Kelly, do you want to? Yeah.
No, I mean, I think, Leah, I think you raise a very, very good point. I think, and that's essentially what these collective collaborations are trying to, you know, to develop not only equity and equality within countries, but also on a global scale. It's as a parent of a rare disease patient, thanks, Luani. I see that Luani has managed to put up a poll. Should rare diseases have a separate budget that is protected and ring-fenced? I'd be very interested to see what the response is. But Leah, in response to what you're saying, as a parent, I can completely sympathize, because for me, it's something that I just can't fathom, how if there's a medication, a treatment for a patient anywhere in the world, why your geographical status or geographical location would be what hinders you from being able to access it. And I think that this is where the collective unity of a global perspective becomes so important, because it gives us the opportunity as a collective to not only raise awareness with our own policymakers, but for countries, etc., around us. Because as a collective global group, if we all stand together, we should all walk away with equitable healthcare. So my advice would just be to, you know, to continue doing everything that you can within your own country, reach out to those around you who've done it in countries, but more importantly, just as a parent, to know that you're not alone in this journey, and that there are others, you know, willing to keep fighting to make sure that patients like your daughter go on to receive her treatment. Flaminia, I'm not sure if you want to add anything.
No, I was saying that now that we have the result of the poll, maybe we can give the floor to Durhane, who was supposed to close the event. And Durhane, if you feel you can build on the results of the poll, which is outstanding in favor of rare diseases specific policy by how many percentage?
89% to 11, so significant.
So thank you very much. This has been an absolutely wonderful opportunity to just celebrate universal health coverage, and especially, as we all know, because of the references to rare diseases, which we have been able to get into it. This is a great opportunity to hear kind of the progress that has been made on universal health coverage, and to really applaud and really encourage people to take a look at the civil society engagement mechanism. That toolkit is very, very good if you want to do advocacy. I'm going to get to the poll in a second, because I have my own opinion on it, and I hope you don't mind if I will interject an opinion onto this. It's always that notion of be careful what you wish for. And I think some of you will know a bit about what that means. There's a risk and a danger in all of this. Certainly it has been, I think, great to hear how much has been done in terms of being able to push forward in terms of universal health coverage, even at this time of COVID, where all attentions are really being turned towards how do you galvanize the resources around it and the attention around it. I think this is critically important. And in some respects, as we all know, COVID has helped us do that. But let me get back to rare diseases. And I will say is that I want to take a half a step back, because this, certainly this forum, but all of the other events that I've been able to take a part in, some in Latin America, recently we had the African Summit, at the Asia Pacific Alliance of Rare Disease Organization, we'll be starting our 2-day summit. I say tonight because I'm doing it tonight, it's tomorrow, for the 14th and 15th in Asia. And I think what has been wonderful is the rare disease community has been moving forward all of this time. And I think during COVID and all of this time, we've really been able to advance continuing on rare diseases. I think the importance of the universal health coverage and rare diseases in it is that it has been a bottom up. I mean, Rare Diseases International, of course, has been key in terms of being able to bring all those voices together, being able to articulate those voices, put some of the research behind it. But at the end of the day, rare diseases is made up of patients, it's made up of families, it's made up of that broad and extended network, really at a very local level. One of the first things I learned when I was at the ICORT conference way back in oh gosh, I can't remember how many years now, in South Africa, was how powerful the local communities are. And I think this is what we're all about. What the universal health coverage gives us, what the UN resolution is going to give us, is not manna from heaven. We're not going to look up and see people pouring resources on us. We're not going to see them opening up policies that say, welcome, come, let us do this for you. We're not going to see health services springing up across, our own communities, nationally, globally, that are going to say, yes, let us embrace rare diseases. All it's given us is the opportunity to have legitimacy and, yes, hopefully policy and funding support for what we're doing. We're not asking for a handout. We're asking for an opportunity to be vibrant, engaged, powerful participants. And this is really the power around the universal health coverage of rare diseases and the power behind the UN resolution. It also opens up other doors for us to say, hey, we need to have equity in education. Hey, we need to have equity in terms of working opportunities. We need to have equity in terms of what you just heard, their diagnosis, the opportunity to get to it. But we will keep pushing for those. And I really was so proud of the conversation between Kelly and Diego, because I think what you folks hit on was exactly the right thing. How do we reach out and help each other? How do we use some of these policies and some of these mechanisms, including RDI, for us to do more of what we're doing? And I think that's what this is all about. So I'm so thrilled that we are taking this opportunity to celebrate Universal Health Coverage Day. I think it's wonderful. As Flaminia says, the 16th, we will have officially a UN resolution. But what we all know is the importance of this is nobody's given us anything. Nothing is going to come as a gift as a result of this. If anything, it just means all of us are going to have to work a whole lot harder. It means all of us are going to be able to see opportunities opening up and saying, yes, we can do this, and we can do this collaboratively. The other thing that's very exciting, certainly around the UN resolution, I think it put rare diseases firmly into the chronic diseases camp. I don't think we were quite there yet. I think with the UN resolution, it will put us firmly into the camp of all the other kinds of important sectors that have not yet been fully embracing rare diseases. But it's not going to do anything for us. We know that. We're still going to knock on the doors. We're still going to create the mechanisms. We're still going to be building tools. We're still going to be raising monies and doing it ourselves. But at least we will now have the support, the policies, and hopefully some of the funding that's going to help us do it and do it, individually. For me, at the end of the day, rare diseases is still all about local communities, like families. And I look at each and every one of you, and I know how much you do locally. I know how much you do with your own hands when you go out there. I look at Ritu, and I know what she does in terms of educating and training other families to do what she's been doing for her own family. This is the first. I know the telehealth that we're doing. So this is all about us at the local level, being able to do more and being able to do it better, being able to do it together, and to have the right to do it with the support. So yes, budgets are important, and we need to make sure we have it. But what that's all going to do is allow us to be able to do more of what we're doing. So congratulations, I say to us. Congratulations, not just to RDI and not just to each one of our regional networks and each one of our national networks, but congratulations to each and every one of us, because what we will continue to do is what we've been doing. Roll up our sleeves, get out there into the trenches, wave the kind of flags that we've got, but also hand out the resources. So congratulations to everybody. So this comes back to the poll, and 89% say yes, it can be a trap. Because once they ringed it and they handed it to you, what we do want to do is we have more diagnostics. We want to have more treatments. We want to have more services. We want to have more centers. And what we do not want to have is a ring budget that says, okay, you got a budget, you figure it out. The other thing that's very important in rare diseases, and I say it over and over again, rare disease is not competitive. There's no competition between Gaucher's and between, EB. There's no competition between, hemophilia and between, many of our major, other neuromuscular diseases. There's no competition here. We're all for one. We work for each other. And we know that what we develop and what we evolve in terms of solutions, strategies, networks, works for everybody. So it's a little bit of a trap. I mean, sure, if they give you a budget to continue to expand as we learn more and have more resources and we're doing more rare diseases, I say hallelujah. If they give you a budget and say, here's what your budget is, and it's going to be for a period of time. And as you do more, you figure out who gets and who doesn't. I don't think so. So we've got a new rare disease drug strategy that's being put forth in Canada. And what we are not going to push for is a dedicated budget. We have a $1 billion budget to set it up, but we're not going to say that goes into just funding the drugs, because it becomes a competition. It is not a competition. So I don't know, be careful what you wish for. Think about it when you say it. It's easy to say, sure, give me the budget, let me hold on to it. The other thing we always know is that, a lot of diseases become rare diseases as we begin to learn what the genetic makeup is, as we begin to learn how much more precision we can be in terms of being able to diagnose a disease. So we say we have 6,000 rare diseases. We could end up having 10,000, 12,000, 20,000, 30,000. What are you going to do then? We are all one community, so rare, infectious, chronic, I don't know. I will hold out my say on it, because I just don't think it can be it can be an easy solution. So huge congratulations for putting this on. Kelly, you did such a masterful job. My hats off to you. Really, really appreciate everybody who participated in the wonderful lineup of speakers. So thank you very much. And all I can say is go out and do more, you guys.